In some other news, cases of norovirus appear to be on the rise across the country. That's according to some new data from the Centers of Disease Control and Prevention. More than 90 outbreaks of the virus were reported during the week of December 5th, the most recent week with available data. Previous year's data show the same week showed a maximum of 65 outbreaks reported. Joining us now, NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, so good to see you as always. So do you believe we're seeing a spike in the norovirus? Anecdotally, seems like a lot of people are sick right now, and it seems deeply unpleasant. Why is it spiking, and how can we mitigate it?
Well, Jonathan, Happy New Year. You know, norovirus, we don't talk a lot about this, but it's the winter vomiting bug. That's the colloquial term for this virus. So I know nobody really wants to talk about that, but here we are. Tends to spike between November and April. To your point, this year, it seems like it's an outlying year in terms of more cases. Hard to know why. We're all indoors. A lot of us are traveling. And so maybe that spike is it's an anomaly, but there's a reason we're seeing it right now. Here's how to distinguish it. The question I get all the time is, how do you know it's norovirus versus, say, something else that might cause GI upset? It's about hallmark. It's about the rapidity of symptom onset, how quick it happens after, say, you ate oysters, which we know has been implicated in some norovirus outbreaks. It happens really quickly, Jonathan, maybe in the matter of even minutes, and that's something to keep in mind. If that's you, or if that's a loved one they should stay home and try to stay isolated from other people, not handling food. And then really, really critical here for those hopping on a flight back or on a train back home from holiday vacation, hand hygiene is critical. And this is where sanitizer is good, but it's not great. You want to wash your hands. If you're going to bring wipes on board, which I highly recommend if you're in the airplane, make sure they have bleach in them. Bleach kills norovirus. The regular ones, just antiseptic wipes, do not. So those are the key things to really keep an eye out for.
All right, good notes there. Let's turn now to the bird flu. Federal health officials are looking at possible mutations that, in theory, might help the virus infect people more easily. I know there's been a lot of real concern online about this in recent days. What do we know about it? How concerned should we be?
I think this should concern us. The fact that this is a virus, this is a form of flu for viewers out there who may not be tracking this, a form of flu commonly found in birds up until about late 2022, hence bird flu. Now we've seen over, say, the last 18 months, this jump from birds to cattle, and now, to other mammalian species like big cats here in Washington State on the West Coast where I'm at. So 20 big cats die. That was, I think, alarming for all of us, deeply unsettling that this virus is quickly jumping from species to species. And now we've seen, even in humans, no evidence of human-to-human transmission, Jonathan, so no public concern quite yet. But there's a reason why the California governor, Gavin Newsom, has declared a state of emergency, because we're seeing of some humans that are getting infected from unclear sources. Some of them, even young ones, like in British Columbia, are ending up incredibly sick, needing advanced ICU level care. So that's why I think what Governor Newsom is doing, one, is going to be an example for parts of the country, which is declaring a state of emergency, doing more surveillance, more testing of, say, cattle farms. We want to know how this virus is changing. And we're seeing some evidence that it is mutating in ways that will allow for easier infection in lungs. And that's what's concerning us here, is that flu changes, flu finds a way. And that's what it seems to be happening here, is it is constantly changing.
Yeah, this won't be our last conversation about this virus, I suspect. Let's turn to a couple other topics now, Dr. Gupta. So there's a recently published study looking at how drinking alcohol, even in moderate amounts, impacts our health. There's been a wave of new science about this in recent years. Tell us the latest.
There's a lot of controversy here. The question here is any alcohol beneficial? And probably, no one's going to love the answer here, but there's going to be some pros and some cons, and that's probably where we're going to land. What this recent study from the National Academy of Medicine, Sciences, and Engineering found was, in effect, it looks like there are some heart health benefits to moderate drinking. So 2 glasses of wine, say, for men, about 1 for women every single day. If you were to stick to moderate drinking guidelines, seems like it may actually improve HDL, so-called good cholesterol, lower bad cholesterol, perhaps improve heart health, may actually cause you to live longer. Again, I caution saying this because lots of studies have shown the opposite. And it seems like, without a doubt, regardless of heart health benefits, Jonathan, seems like there is a cancer risk. You cannot ignore it. So it does seem like alcohol in any amount is a carcinogen. I think that's where we're going to land, especially for things like colorectal cancer. But it also does seem at the same time, another thing can be true, can benefit the heart and improve heart health. So I think a little bit of good news coupled with some cautionary news. And I think that's where we're ultimately going to land here.
Yeah, it certainly does seem like, as a society, less and less drinking in recent years, particularly post-pandemic, and of course, dry January, a popular phenomenon. And Dr. Gupta, let's talk about, our top story today, of course, is the terrible incident in New Orleans. And talk to us, if you will, about the first responders or who are there helping those wounded or killed, civilians who witnessed it. Talk to us about how a human responds to those mass casualty events, and how it impacts them, emotionally and psychologically. What sort of help might they need?
Yeah, absolutely. I mean, obviously, a horrific event, and the first responders are always heroes, whether it's this event, prior events. I'm sure we'll be dealing with something in the future. Number one, the immediate response here was incredible, and I think we should really give voice to that. That immediate triaging is, who needs actual critical care services. There's tremendous healthcare systems in NOLA, like Ochsner, like the University Medical Center, LCMC Health. I have a lot of colleagues down there that are doing incredible work. This is not their first mass casualty event, as you know, and they color code patients that need to be immediately triaged, and that's what was happening. And so there's still a lot in critical care, a lot of surgical needs, and that's what they're sorting out. So the acute response still, Jonathan, is very much the focus. But to your point, psychological trauma, it sets in after any mass casualty event, both for the first responders and also for people that, to your point, may have witnessed it. PTSD is a real thing. And so that is where counseling support, part of the recovery phase of any mass casualty event, is going to be really critical here, providing psychological support and those therapeutic needs. But I'll say right now, we're still very much in the acute phase. Can we still save many of those that are in critical care still in the hospital?
NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, thank you. Happy New Year. We'll speak to you again soon.